Hi, I'm Ashley Leffelholtz, the Clinical Health Director for Honor RX Pharmacies. Today's clinical tidbit is the ACIP, or the Advisory Committee on Immunization Practices, their vaccine updates after their summer meeting. So just some key takeaways. They voted on 4 different vaccine recommendations during their last meeting. So those are RSV, the pneumococcal, COVID, and influenza. So I'll dive into each one of those just a little deeper. So, starting with RSV, for those that aren't super familiar, respiratory syncytial virus, or RSV, is a respiratory illness. It usually causes mild cold like symptoms. However, some patients are at a higher risk of more serious complications. Those patients that are at higher risk involve or include children greater than less than 12 months of age. However, usually in the ones less than 6 months of age, older adults, adults with chronic health conditions such as heart or lung disease, weakened immune systems, or other underlying medical conditions, or those who live in nursing homes or long-term care facilities. So, in those patients, RSVs can cause bronchiolitis and pneumonia. It can also worsen other conditions such as asthma or COPD. So the ACIP recently updated the recommendations on this vaccine. So the old guidelines stated that patients between 60 and 74 could get the vaccine based on shared clinical decision making. So that is no longer quite the case. So the new recommendations, patients 75 years of age and older should receive a single dose of this RSV vaccine, regardless of their health history. So this is, as I should say right now, is a lifetime dose. So if a patient got a dose before they were 75 and have now turned 75, that dose does not need to be repeated. They are looking into repeatability and long-term effectiveness of this vaccine, but at this time, there's no recommendation to get a repeat dose. Patients 60 to 74 years of age must have a chronic medical condition or risk factor as listed by the CDC. So it's no longer that shared clinical decision making that I spoke of. So of note, the CDC risk factors will be published, but they're going to be a little more restrictive than some of the old guidelines. For instance, for patients for the COVID vaccine, one of the risk factors was just having diabetes. Now it'll be diabetes with complications. So a little more specific, more information to come on that later by the CDC once they get that all published. And then Moderna, right now there are 2 RSV vaccines available, a Arexvy and a Brisvo. Moderna just recently got their Mrezvia. Hopefully I'm saying that right. It's not out yet. But that was just recently approved by the FDA. So there will be 3 options going forward. They did not make any mention of one being preferred over the other. Moving on to pneumococcal vaccine. Pneumonia vaccines help prevent against pneumococcal disease. So this is any type of illness caused by the strep pneumobacteria. So that can include different disease states. So it's not just pneumonia, it also includes meningitis and bacteremia. So the symptoms depend on what part of the body is infected. So I mentioned meningitis. That's an infection of the lining of the brain and the spinal cord. That can include confusion, fever, headaches, photophobia, your sensitivity to light, stiff neck. And in babies, meningitis can cause poor eating, drinking, low alertness, and vomiting. And then for pneumonia, the symptoms of that, it can cause chest pain, cough, fevers and chills, rapid breathing or difficulty breathing. Older adults might also experience confusion or low alertness rather than the more common symptoms that I mentioned. And then bacteremia, the bloodstream infection, the symptoms of that usually include chills, fever, and low alertness. So currently, there are 2 pneumonia vaccines currently recommended. Those would be the conjugate vaccines and the polysaccharide vaccines. The conjugates, PCV15, PCV20, and now there is a new one just coming out called PCV21, manufactured by Merck. It's called Capvaxive. It's not quite available yet, but we'll dig a little deeper into that one as well. For the guidelines, the ACIP did affirm that PCV21, like I mentioned, the Capvaxive, is an option for adults 19 and older who are currently recommended to receive a dose of the PCV vaccine. They did not mention or vote on whether or not PCV 21 was going to be preferred over the PCV 20. So either vaccine is an acceptable option. For those patients that are up to date on pneumonia vaccines and have gotten their PCV 20, they are not recommending a booster of the PCV 21, at least at this time. So stay tuned to see if that changes down the road. But right now, that series would be considered complete. So PCV 20 versus PCV 21. So the biggest difference is the serotype coverage. So it's not just PCV 20 is 20 strains, PCV 21, it's not the same 20 plus one more, it's different strains. So the serotype coverage, this is from epidemiological data. It is not a statement of efficacy. They haven't done any head-to-head studies yet between the two. But in adults 50 years of age and older, the PCV21 covers the serotypes responsible for 84% of the invasive pneumonia disease, pneumococcal disease cases, compared to 52% covered by the PCV20. So it does cover more of those serotypes. And then in adults 65 and older, the PCV21 covers the serotypes that are responsible for 85% versus 51%. So like I said, there aren't any head-to-head studies. I'm not sure if they'll do one in the future, but right now it's either or is fine. PCV21 has 8 unique serotypes that aren't covered by the other approved vaccines. And then of mention, for those providers out there that are looking to figure out which pneumonia vaccine a patient is due for, Pneumorex is a great app. It's put out by the CDC. It's PNEUMO-REX, RECS. It's a great tool to use for your patients to see which vaccine they're currently due for. It just asks you a couple questions about their health history and their age, and it'll give you a recommendation. So super handy if you're not super up to date with the algorithm. But moving on to COVID-19, the ACIP does recommend that whatever the new 24-25 COVID vaccine as authorized or approved by the FDA, and that's still in patients 6 months of age and older. So the 23-24, so the current vaccine that is circulating will be removed from circulation when the 24-25 version is available. We're expecting that in middle to late August. So hopefully there won't be too much of an overlap or a period of time when there's no COVID vaccine available. But basically we're going to keep the old one in circulation until the new one is released, and then we'll switch those out. So when respiratory season hits, you'll want to get that new 24-25 vaccine. There is not any specific recommendations regarding boosters at this time. They will say, or they did say, that patients over 65 are still eligible for an additional dose of the COVID vaccine at least 4 months after their previous dose. So something to keep in mind there. And then just real quick on the influenza vaccine, they basically just reaffirmed. So yes, everyone should still get an influenza vaccine. That hasn't changed. The quadrivalent vaccine has been replaced with a trivalent. So they just took one of the strains out that's no longer circulating. They decided that wasn't needed anymore. So all flu vaccine will just have the 3 strains in it again. And then the last thing they did mention was the high dose or inactivated influenza vaccines are acceptable options for those solid organ transplant recipients who are 18 to 64 years of age, who are on immunosuppressive medications without a preference over other age-appropriate vaccines. So basically those patients who are 18 to 64 but have had a solid organ transplant, they can go ahead and get a high dose flu vaccine without any issues. So hopefully that would go through insurance since it's approved, but otherwise they didn't say without a preference, or they didn't have a preference, so either would be appropriate. So that's kind of a recap on the updated vaccines, references for the presentation. And then be sure to ask your pharmacist if you have any questions. We're your one-stop shop for vaccines. So usually if you have any questions about what vaccines you're due for, or have any questions about specific vaccines, your pharmacist is a great resource. Again, thank you for your time and have a great day.